scheduled to begin in January. Today was another record-setting day for the number of coronavirus cases here in Ohio, with more than 2,300 new cases in 24 hours, the fourth time in the past week that the daily record has been broken. So, are local hospitals prepared for a second wave of COVID? The two major systems here say they learned a lot from the spring outbreak. 13 ABC's Melissa Veitch checked in with both Mercy and ProMedica. She's here live with the latest. Melissa. Melissa.
Well, Diane, the short answer to all of this is that hospitals are prepared as they can be for a second wave. Here, again, we're coinciding with the flu, so they're trying to keep it as low as possible. But, as you mentioned, they learned a lot. They have a lot in place should we get a second wave. ProMedica Dr. Brian Kaminski tells me the hospital system is ready should we see a second wave of COVID.
Now we are starting to see a little bit of an uptake. It's not as much of an uptick as some other areas of the state or some other areas of the country are seeing right now.
During the first wave of COVID, ProMedica designated Bay Park Hospital as its COVID treatment center. This time, all hospitals will treat COVID-19 patients in a dedicated unit.
And we have the ability to expand our care treatment areas within each hospital. So within each hospital, depending on the situation, we have a number of different measures that we can deploy to increase our capacity and also to reduce volume.
Mercy Health Hospital is feeling better prepared as well. Dr. Kevin Casey says it's a bit of a quiet before the possible storm.
We haven't seen an equal number of increase in the hospitalization rate at this point, which we're very thankful for, knowing that we were very concerned in the spring that we would be overwhelmed.
Aside from Perrysburg Hospital, all other Mercy Health inpatient hospitals will treat COVID patients in special units
that are set aside, that have negative pressure ventilation rooms, have the PPE, have dedicated staff, all those sorts of things to keep those four guiding principles we've had: minimize exposure to the virus, contain the virus as much as possible, conserve our resources, and protect our healthcare workers.
At this point, there are no plans to limit or cancel elective surgeries at either institution. Patients are screened for COVID prior to procedures. But, Diane, if they have to, they will, of course, cut back on elective surgeries. And this is something else interesting, Diane, that I have been speaking with a good number of doctors, many of whom are emergency room doctors and intensivists. And they do tell me that while we do have ICU patients, by and large, patients who are coming in, while they're sick and they are admitted, they are not as sick as patients in the first wave. At least that seems to be the trend so far. So that's promising, at least on that end. Back to you, Diane.
Sure is. All right, Melissa, thanks. Well, Michigan Governor Gretchen Whitmer says she's sounding the alarm when it comes to COVID-19 cases in her state. In a briefing today,